Good morning, everyone. I am really excited to talk about my biotechnology project that I worked by myself the entire semester um, that mirrors pharmacokinetic math models as a very friendly, patient-friendly dose tracker that I think, is super useful for patients while administering oral treatments. So I chose to target treatments using amoxicillin as an antibiotic because it's a really common antibiotic that targets a wide range of bacterial infections. Um, and that means that I have most of the parameters well studied that I can use to build my models, and I don't have, and my stakes on wrong administration of drugs are low stakes and really applicable to a wide range of patients at this point while I was building the prototype. So one of the problems that arise when I see patients take oral medications is that they've more often than not, forgot their doses. And so what they would typically do is skipping one dose or two, thinking that it's gonna have little to no stakes on their treatments or their efficacies of their medications. And so I want to build this model just to see how much of those skipping drugs or how much of those overdoses are going to hurt them in the long run towards the entire course of the medication. And so um, by that, I want to use my pharmacokinetic models, which very much investigates how the drugs interact with your with the body, and how those drugs distribute across drug concentrations rather distribute along the entire body via absorption, distribution, metabolism, and their excretion away from the body. And for this project, I'm starting really slow by really assuming the body as one well-stored compartment, aka reactor, that uniformly and instantly distributes drugs, kind of in the same way a CSTR would distribute drugs and react, if you will. So I really want to use this project as a way to help patients keep track of their own doses and really really want to take drugs responsibly and adequately. Um, Now, with clinical guidance as something looming in the back for them to administer the drugs themselves. And by doing so, I want to visualize just how the ideal doses are efficient to um, in that sense. Yeah, saying how ideal their doses are, ideal dosing efficacy, and possibly how poor adherence really impacts that dosing efficacy and raises that clinical stakes. So project prototype that I built for this project are a MATLAB live script. That means that it's going to churn out outputs beneath the lines of code. And so it should be visible to patients after each iterations that they run the code. And with that, there's always room for those inputs that the patients have to fill in by themselves. For example, their personal information, their disease that they want to treat, their start of treatment, as you can see right in the left panel, and there's one entire section onto logging doses by day, by time, and by um, the actual dose in milligrams. And as you can see, I actually noted how I give some sort of notes on um, my example run, as in I if their drugs are some at some time late or skipped or are early, or in this case there is there is a case then that I can throw in a sort of overdose to see how much clinical stakes that stack up across the entire regime. And so this is the one compartment mathematical model that I want to use. Um, and as you can see, they pretty much should mirror what you would see out of a first reaction order, as you can see with the exponents on here. And again, these parameters are something that have been well studied and have been well averaged across a good sample within the population. And so it gives us some really nice graphical, really a nice graph to look at. This is, by the way, this is a model of drug concentrations or plasma concentrations, as they might use in jargon, across a full 7-day amoxicillin course. And as you can see, each of those peaks correspond to um, each of those individual doses. And so you might see those peaks appearing in green in ideal cases when you take drugs regularly. Um, by the way, in mild pneumonia, your prescribed dose would be 3 times per day, and for 500 milligrams 3 times per day for 7 days. And so you can see how those peaks stack up really nicely, as opposed to the actual doses that I logged in for the input. And you might see some much more irregularities, or where those dashes in blue do not line up with the real ideal dosage. And that's going to create a surplus or a deficit from the recommended dose. Um, which really lines up with what we should expect, right? Because this is that exact 1,000 milligram dose, or the double dose that I logged in from in day 3. And that's going to result in a really high delta concentration, which poses a real risk to patients, outside from the efficacy of the drug. And also, my model also calculated some other metrics, which include um, the time above that minimum concentration that is useful to fight against the disease, the amount of the area under curve, which is another biomedical parameter used in pharmacokinetics. And there's also minimum and maximum drug concentrations, which is sees just how erratic the body receives those drugs over that 7-day course. And I learned a lot from this project, actually. Um, I It really is interesting to really apply pharmacokinetic models on a longer time scale, which is multiple dose cycles. I'm talking 20 or 30 dose cycles, that each of those cycles correspond to a dose that patient might have skipped or might have taken late. Uh, in um, And as you can see over in my graphical representation, it really helps visualize um, our just how I just as how our actual doses deviate from the recommended regime of treatment. And we actually, and we also get to test our clinical instructions in case of um, disruptions, I would say. As in, if I, for example, if I were to accidentally take drugs 2 hours late, then I can just delay the next dose by an hour, for example, and continue my doses as normal. Or if I accidentally skipped my previous dose, then my next dose should be shifted earlier, for example, rather than trying to double it up to make up for the lost dose, for example. And so that is much more useful for me than trying to hear from doctors, because doctors are not always present all the time throughout that 7-day course to guide us through with administering drugs in that way. And so, of course, this is just a prototype, and I want to the and some possible improvements that I can make after this project, if possible, is to really test out other pharmacokinetic models and to narrow and so to limit the assumptions and really adjust for patients by in a case by case scenario. For example, the influence of age, of gender, and body weight that really affects their personal metabolism, um, and as well as trying to venture out onto injected drugs as well. Just visualize how the drugs affect their body and possibly manage side effects as well. And of course, user-friendly interfaces is crucial to make sure that patients really make the most out of the pharmacokinetic dose tracker. And so that is that is my project that I um, applied for biotechnology with the help of some of my friends who are also biomedical science majors. And I'm willing to take feedback from all of you if that's the case.